Oregon Health and Science University stands with, supports, and will fight for Black lives. We are facing a viral pandemic, but there is a pandemic rooted in the foundation of this country that is more devastating.
Racism cannot be prevented with a vaccine, cannot be relieved by a ventilator, and cannot be halted by wearing a mask.
I can't breathe because of COVID-19. I can't breathe because of social injustice. I can't breathe because Black men are 3 times more likely to be killed at the hands of police.
The horrific murder of George Floyd was one instance of police brutality against Black Americans, but there are countless others. We, OHSU, say their names.
George Floyd,
Breonna Taylor,
Ahmaud Arbery,
Eric Garner,
Sandra Bland,
Trayvon Martin,
Tony McDade,
Jason Washington.
These are just some of the names we know of, but many we do not.
Police brutality is not the only thing that kills thousands of Black Americans. Healthcare is not immune. We must turn our gaze inward.
From the moment they are born, Black Americans face higher mortality rates than white Americans. Black infant mortality rates are 2 times higher than that of white infants.
Black Americans are also more likely to die from COVID-19, heart disease, and infectious diseases. Black Americans suffer from diabetes and high blood pressure at higher rates.
On average, Black Americans live 5 to 10 years less than white Americans. Identifying as LGBTQ compounds these health disparities.
Black patients experience longer wait times, insufficient pain control, and less time overall with their providers. This leads to measurably worsened health outcomes for Black communities.
The existence of these health disparities is partially attributed to underrepresentation in healthcare. In the US, only 5% of physicians, 4% of pharmacists, 3% of physician assistants, 10% of nurses, and 3% of dentists are Black.
Within the last 30 years, the number of Black males attending medical schools has not increased, despite medical school programs more than doubling in number.
How can we expect representation to increase when predominantly Black schools are grossly underfunded? Our Black brothers and sisters face racial discrimination in every facet of their lives, from the moment they take their first breath to the moment they may be forced to take their last.
As public health practitioners, as doctors, as nurses, as medical students, as physician assistants, as dentists, as pharmacists, as scientists, as staff and faculty, we stand for justice.
I solemnly pledge to dedicate my life.
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 We solemnly pledge to dedicate our lives to the service of humanity. We must lead the charge. We recognize the treatment of Black Americans in this country is a public health emergency.
We demand action. We challenge healthcare institutions across our home state of Oregon and nationwide to stand with us.
We require a targeted hiring of diverse populations, an increase in Black enrollment across healthcare programs, and further funding for programs promoting diversity and inclusion.
We cannot wait any longer. The time is now. Black lives matter.